Welcome to OOTO TV, the out-of-the-office investigation from our past into the future of personal health and psychophysiological actualization. This time we're discussing frequency-specific microcurrent therapy, healing through frequency-specific microcurrent health therapy.
Bouchamp, we're diving into a topic that, it really sounds like science fiction, but it's actually grounded in almost a century of research. Frequency-specific microcurrent, or FSM.
It really is. We're talking about a non-invasive technology using these, incredibly subtle electrical currents. And they're used to address some really complex issues, from pain and physical trauma all the way to deep chronic conditions.
Exactly. And our sources for today, we're looking at pilot randomized controlled trials, some really detailed clinical reports. They all seem to position FSM as a potentially revolutionary tool.
Right, because we're moving beyond just, masking symptoms. We're actually looking at how these specific frequencies might be able to reset the body's own physiological and cellular mechanisms.
That's the goal. So today we're going to explore the mechanism of biological resonance, look at some really compelling evidence in tough conditions, things like scleroderma, hypermobility, and then we'll analyze the clinical trial results that compare FSM's speed and its efficacy against more traditional relaxation techniques.
It's a crucial area of study, really, for anyone looking for relief that doesn't just come from a pill bottle. So, Pastor, before we get into the sources, I have to ask, for the listener maybe just catching up on this field, how can FSM therapy affect our mental and physical health?
Well, the essential promise of FSM is that it treats the body as an electrical system. The underlying principle of FSM suggests our bodies are inherently electric, and each organ and muscle has a frequency that may be modulated for good, for health.
Okay, an electrical system.
Right, and by finding and then matching those very specific frequencies, we can, in theory, correct dysfunctions, dial down inflammation, and really accelerate tissue repair.
All right, let's get into the science of this because it's fascinating. FSM is defined by its subtlety. We're talking about microampere electrical currents. That's 1/1,000,000th of an ampere. It's so low that, you often don't even feel it. It's subsensory.
And it's important to note the FDA has already approved the microcurrent aspect. It's considered safe for use.
Okay, so that's the current. But the real question, Pastor, is what are the key elements of FSM therapy? What makes it different from, say, just slapping on a generic 10 ENS unit?
That is the critical question. That's where the frequency-specific part comes in. The whole foundation of FSM is applying paired frequencies. They're delivered via these specialized devices, usually with conductive gloves or patches.
Paired frequencies, so two at once.
Two at once, exactly. You have one frequency that's chosen for the type of tissue, like a muscle, a nerve, or even scar tissue. And then a second frequency is chosen for the condition that's affecting that tissue. So, inflammation or damage or tearing.
Wow. Like a combination lock for healing, isn't it? And what I find so interesting is that this entire concept, this list of frequencies, it comes from a device made in 1922.
It does. It sounds almost mystical, but our sources are showing that today, in modern clinical settings, it's working. The goal is biological resonance.
The tuning fork effect.
That's the perfect analogy. If the correct frequency is applied, it creates that tuning fork effect in the tissue. It harmonizes it. And that resonance is what's thought to sort of reboot the entire healing process.
Yeah, you can actually see the effects happen in real time. The sources are so consistent on this. They describe a palpable physical change in tissue texture, often within seconds.
Seconds, yeah. Tissues that were hard and tense, hypertonic, they just begin to soften and warm up. And not just on the surface. This happens in deep skeletal muscles, too.
That rapid softening has to be a clue that something big is happening on a cellular level.
It is. When you look closer at the mechanism, studies in rat skin have shown that this kind of microcurrent therapy can dramatically increase ATP generation.
ATP being the main energy source for our cells.
The primary fuel. So increasing ATP is it's like giving the cells this huge energy boost. It provides them the fuel they need to finally exit that defensive, contracted state.
This speaks to the idea that FSM stimulates a healthy environment for cellular growth and success. The cells are finally getting enough energy to let go of that chronic tension and, start the repair process. That's why the tissue softens so fast.
Precisely. And moving from the lab to the clinic, FSM is being used for a whole range of things, fibromyalgia, chronic migraines. But where it really shines is in these challenging conditions where conventional medicine often, frankly, struggles.
Let's focus on one of those, scleroderma, systemic sclerosis. This is a terrible condition that causes hardening and scarring in connective tissue. It can be debilitating, especially for hand function.
And treatment options are so limited. The sources we looked at detail 2 pilot studies. They involve 17 patients, all treated with these very specific FSM protocols targeting the tissue layers and the disease process itself.
How specific are we talking?
Very. They were using 13 hertz for the scarring, 3 hertz for the sclerosis, and 49 hertz for vitality. And those were paired with frequencies for the skin, the connective tissue, and even the capillaries.
And the results were, they were just astonishing.
They really were. The combined studies showed an average improvement in hand function of 40%.
40%?
Yeah.
In a single 40 to 60-minute session? That speed it's almost unbelievable for a condition defined by physical hardening of tissue.
It's the speed of biological resonance combined with that ATP boost we were just talking about. In a condition like scleroderma, the tissue is basically stuck. It's in a contracted cross-linked state. By introducing the precise frequency, the electrical charge seems to interrupt those pathological bonds, and that immediately lets the tissue hydrate and soften.
The anecdotes were so powerful. You had patients who found picking up a coin nearly impossible before the session.
And then they're doing it without difficulty right after.
Just think about the real-world impact of that. The sources mentioned one patient, a musician, who could play the double bass again. Another could finally sew.
And that brings us to another case, the 33-year-old woman with hypermobility spectrum disorder, HSD. She had chronic pain and anxiety.
Yes, the HSD case is so important because it's not just about pain. It's about structural stability. They used frequencies to correct for torn and broken connective tissue. She reported feeling sturdier, and you could actually see a decrease in her wrist flexion right after the treatment.
It showed it could improve stability. So based on these incredibly rapid responses in such complex tissue disorders, I would state that exposure to FSM is critical to our healthy recovery and pain reduction.
You're listening to OOTO TV with research by author Paul Bulow. Okay, so we've moved from physical scarring in the hands to the invisible scarring of emotional trauma. This might be where FSM's biggest potential lies, not in the muscle, but in the mind. The perspective in our sources is that conditions like PTSD and chronic anxiety, they aren't just emotional. They have physiological layers, specifically neuroinflammation.
Exactly. When you're under chronic stress, your body releases these inflammatory messengers, these cytokines, and they disrupt normal brain function. They create an overactive stress response. And that whole system is managed by the vagus nerve.
The body's superhighway, right? Connecting the brain to the heart, the lungs, the gut.
The master regulator. The theory is that trauma weakens the vagus nerve's ability to, regulate. It keeps the body stuck in that perpetual fight or flight mode. So FSM applies frequencies that are thought to support vagal tone to enhance the parasympathetic function, essentially signaling safety to the entire nervous system.
And that connects directly to the cell danger response, the CDR.
Yes, the CDR. It's this metabolic state where cells get overwhelmed by stress or trauma and they just stay trapped in an inflammatory defense mode. They get stuck. And that's where you get symptoms like crippling fatigue and cognitive fog. By supporting the vagal tone with FSM, the body gets the signal that it's safe to finally resolve the CDR and shift into repair.
And this isn't just theory. There's compelling biochemical evidence. A landmark fibromyalgia study found that FSM treatments actually reduced inflammatory messengers tied to chronic pain.
It did. It reduced things like IL-1, IL-6, TNF-alpha, all those proteins that drive swelling and pain. But what's really important is that while it was reducing those, it was simultaneously boosting beneficial things like beta-endorphin, which is a natural painkiller, and cortisol.
But the cortisol increase wasn't from a stress response.
That's the key. It was a non-stress-related cortisol increase, which suggests the body was just managing its resources better, not panicking.
And you see this translate into real improvements in mood. A pilot study on microcurrent neurofeedback showed significant improvement in depression, anxiety, and PTSD risk within 10 to 20 sessions.
A sustained positive impact. And other research, particularly in mouse models for Alzheimer's, is showing that microcurrent therapy could improve memory and inhibit the neuroinflammatory proteins that are markers of brain decay. It's connecting FSM to these really fundamental neurological recovery pathways.
So therefore, the evidence strongly suggests FSM can be linked to pain reduction, improved mood, and increased longevity. It's really targeting these deep cellular and neuroimmune pathways.
Which brings us to the final piece of this puzzle, the objective clinical efficacy. We're looking at that pilot RCT by Pereira and his team. They compared FSM against relaxation techniques for adults with high stress.
And they set up a few groups, FSM alone, FSM combined with relaxation, relaxation alone, and then a control.
Right. And the analysis after just 6 sessions gave us the most immediate insight into FSM speed, The group that got FSM combined with relaxation reported significantly fewer physical symptoms, somatic symptoms, and less negative emotion than the group that only got relaxation.
So it suggests FSM offers faster, maybe more profound relief from the physical side of stress, at least early on.
That seems to be the case. That distinction between the physical and the cognitive is where the real nuance is. When you look at the improvements within each group, you see that somatic symptoms and life satisfaction improved significantly across all the active groups after 6 or 12 sessions. So relaxation definitely works.
But FSM appears to jumpstart the physiological side of things much faster.
Exactly. It had a more robust, earlier effect on reducing perceived stress and negative emotions. It got there in 6 sessions, where relaxation took a bit longer to show the same changes.
So, given all these promising results, both alone and combined with relaxation, can FSM therapy improve our human health? Not just physically, but psychologically as well.
It appears highly effective, Beauchamp. FSM seems to provide these more immediate physiological benefits, like the reduced perceived stress in just half a dozen sessions. However, the data also shows that the more complex cognitive emotional processes, things like building robust emotion regulation skills or achieving a greater satisfaction with life, that often required the full 12 sessions.
Regardless of which intervention they were getting.
Regardless. And that tells us something really important. It suggests that while FSM can rapidly stabilize the body's electrical and chemical environment, the cognitive adaptation that has to follow, that still takes time.
That's a critical takeaway. FSM can fix the hardware faster, but the software update still requires practice and, well, time.
And, we have to maintain a balanced view. This was a pilot study. It wasn't fully randomized or blinded, so we have to be cautious about generalizing too strongly.
The authors themselves stress the need for larger definitive trials that use objective physiological markers, things like cortisol levels, heart rate variability, to really confirm the magnitude of these effects. That grounded perspective is vital. Okay, let's synthesize the core insights here. FSM targets the body's bioelectrical system, and we saw its power to rapidly modulate tissue function, giving immediate, significant relief in tough conditions like scleroderma.
And we've connected its benefits far beyond just muscle pain. We've shown its potential to address the physiological roots of mental health by improving vagal tone, by resolving neural inflammation, and helping the body move out of that chronic defense mode.
The recurring theme seems to be this balance between speed and depth. FSM is fast for the physiological symptoms, giving real relief in maybe 6 sessions. But for those bigger long-term goals of emotional regulation and self-efficacy, a longer commitment of around 12 sessions seems to be necessary.
It really emerges as a powerful, non-invasive, complementary approach for managing a whole spectrum of human ailments. And ultimately, Beauchamp, we're dealing with a therapy that uses frequencies from technology that's nearly 100 years old. Yet these specific frequencies are creating immediate, significant changes in modern chronic diseases, which leaves us with a final thought for you to explore. What deeper bioelectrical laws of the human body are we only just beginning to rediscover and harness for long-term health actualization?
A truly electrifying thought, Pasteur. Thank you for guiding us through this comprehensive investigation.